It's a great pleasure for us to co-host this event on leveraging cash transfers to reduce intimate partner violence at scale, and to feature new research from the Cash Transfer and Intimate Partner Violence Research Collaborative, the Prevention Collaborative, and the International Rescue Committee. My name is Theresia Thailin, and I will be moderating today. I work here at UN Women, overseeing our work on humanitarian research, as well as our work on engendering the grand bargain, including the large focus there on cash. I'm stepping in today to replace our Director of Humanitarian Action and Crisis Response, Mr. Dan Seymour, who was called into a last-minute other meeting. So I will be stepping in for him, unfortunately. Before I say a couple of words, I will hand over to my co-host today, Mrs. Sarah Mishihu, who, as I said, is the senior economist in the Department of Social Protection, where she coordinates work on social protection and is contributing to development of the second phase of the Productive Social Safety Net, the flagship social protection program of Tanzania, that currently reaches 1.2 million households nationally. Sarah, the floor is yours.
Yeah, so thank you very much, and good morning, everybody. Yeah, so maybe first I should thank the organizer, and really I should say it's a pleasure to be invited to be a co-host of this side event. Maybe I can say a little bit about Tanzania and why we're glad at least we get this opportunity. Tanzania has a strong policy framework on gender equality, which in a way it requires a strong recognition of the role of social protection in promoting gender equality and reducing violence. But at the same time, this gap it kinds of somehow filled with the social protection policy, which we recently reviewed, which has been able to mainstream the issues of gender in the policy as a cross-cutting issue, but again somehow clearly try to expand the issue of social assistance and social insurance, which is opportunity for us, which was not there before. So really to be a co-host of this panel, for me, I see it's an opportunity for the country, given the fact that we have a big program, a productive social safety net, which is nationwide a program, implement cash transfer, public work, and I know most of you know that, cash transfer and livelihood enhancement. So by getting all these kind of findings here today, in a way they will be able to contribute, or in a way it will inform the program, which now we're about to go to a PCSN2. The first one has ended and now we're going to another phase. So I really am glad to be here, and I'm sure the findings will do a great job in what we're doing at the moment. Thank you.
Thank you very much, Sarah. Before we get into the presentation, I will just say a couple of words myself. As you know, the pretext for this event today is that we're looking at that globally over 1.9 billion people benefit from social safety nets around the world. And in the area where I work on humanitarian action, we are also seeing a very rapid increase of the use of cash-based interventions currently. So as UN Women, we are very interested in better understanding the effect of cash transfers on a variety of gender outcomes, including, of course, on IPV and other forms of violence against women. Just wanted to mention that we have just published a paper together with the Cash Learning Partnership, and we're about to publish a larger literature review looking at what we know and what we don't know on cash-based intervention and their effects on a variety of gender outcomes in the area of poverty reduction, health, women's empowerment, decision-making, education, and of course also on protection dimensions. Just as in today's event, we will see that, of course, the majority of the evidence that is out there today stems from the development sectors, but we are also very eager to see an increase in evidence generated also in humanitarian settings, where, of course, we have many of the women that are the furthest left behind. So I know Catherine Falk from the International Rescue Committee will speak more about this also in our third presentation today. I just wanted to mention also very, very briefly 2 points regarding UN Women's programming and policy in relation to cash-based transfers and research. We are very pleased actually to see that from our own programming, we are starting to also be able to generate evidence in this area. And I would like to highlight our work in our Cash for Work program in the Satar and Azraq refugee camp in Jordan, where we have just done a new study of our OASIS model, which is a center for multi-sectoral services provided to women. And this new study now has shown that involvement in UN Women's full-time Cash for Work program in combination with also access to public spaces, as well as the ability to meet with peers and build social capital, has generated a 20% decrease in levels of domestic violence among the women participating in the program. And it has also led to an increase in household decision-making with 70% of the women in the program. And we've also seen other effects, such as women self-reporting lower levels of feeling of isolation, as well as feelings of depression. So I think this is very positive emerging evidence that is contributing to these research gaps as well. On the policy side, I wanted to highlight that UN Women is very proud to also be co-chairing the Grand Bargain Cash and Gender sub-work stream that was just established last year by us together with CARE. I think here also among our members in the sub-work stream, we have seen a particular interest from practitioners also really to bridge this research gap. So I think that the field is kind of screaming for the evidence that the researchers here today will present to us, and how that can be applied to humanitarian settings. And that is why also next month we are hosting a learning workshop for the sub-work stream in Washington, where we hope also that the discussion today can feed into that process. I will not, there's a lot to say, but I think I will stop there because we all want to hear the fabulous presentations. So I will start with handing over to Lori Heise, who will give us an evidence overview globally. Lori Heise is a professor of gender, violence and health at the Johns Hopkins Bloomberg School of Public Health, with a joint appointment in the School of Nursing. She has over 25 years of experience working in the areas of gender, violence against women, social change, and women's economic and social empowerment. Her current research focuses on preventing violence against women and children in the family, transforming gender norms, and serving as technical director of the Prevention Collaborative, a new global initiative designed to support evidence-based GBV prevention programming in the global south. Lori, the floor is yours. Thank you very much.
Great. Oh, wow, great. Come on in. Let's just take a second and let people, great. Come in. Hi. It is so hard to get between these events, you know? It's crazy. So, thank you all for coming today. As Teresa said, my background is actually much more in the violence against women space. But one of the things that has brought me personally to this work is that we're grappling with the issue of scale. There's so many of the programs that we have developed that work quite well in terms of reducing violence still reach only a small geographic area. So how do we think about making a difference in terms of lowering levels of violence at a much bigger scale? And that's what brought us to thinking about what are platforms of work that are already going on that we could engage with and think about what are their implications in terms of reducing violence, and are there ways in which we can tweak these programs or do add-on programming to maximize both their positive impacts and minimize any potential negative impacts. So what I'm going to just do is give a brief overview. I want to do just a brief overview of social protection in general for the violence folks that are in the room, and it may be sort of a new area. And then I want to share some findings of a big review that I was involved in to try to systematize, okay, where are we? What do we know now? What are the questions, the big gaps in our knowledge, and sort of where do we need to go to better understand the potential benefits of cash programming, social protection for violence against women and children. And then I just want to offer a few quick ideas about next steps and where we need to go. So when I first came to this field, I found the language really confusing. So I just wanted to offer this sort of orientation to the language, that the biggest category of programming is called social protection. And that actually includes a lot of things beyond cash, right? So that's things including a country's health and welfare programs, insurance schemes, labor market policies, all of the things that a country has its toolkit to be able to protect people from shocks and economic challenges that they may face. A subset of that is called the social safety net programs. And those are actually the ones which people themselves get without putting money into it. So they're called non-contributory. So it means things where it's directly giving services to individuals. There are public works programs, school feeding programs, subsidies for fuel, things like that. And that's where you see also cash. And so a subset of social safety nets, right, are these idea of actually directly giving cash to families or to women or to adolescent girls or whomever in order to try to give them the opportunity to figure out how to use that and to maximize their benefit. Again, you'll hear this other piece of language in this field, which is conditional versus unconditional. And that basically means either you get the cash just because you have a child and it's a child grant program. There's nothing you necessarily have to do as long as you qualify for the program. Or it can be conditional, which means, okay, there's another program that you need to participate or a set of activities. You need to take your child to get immunized. You need to engage in a nutrition program. So this is the sort of wraparound programming, or you need to keep your children in school. So you are eligible as long as you do these other conditional activities. So one of the reasons that it's really quite an interesting moment is if you start to look at the coverage of these programs. Now, it's hard to see. So it starts at the top, for those that can't see, Europe and Central Asia. Like 84% of the population in Europe and in Central Asia have access to at least one of these social safety nets. Many of them have multiple kinds of social safety nets. All the way down to sub-Saharan Africa, where you see only about 13% of people currently have access to any social safety net that may or may not be cash. It might be one of these other things that we were talking about, right? But if you look at the growth, okay, this is another graph. You don't have to really look at the numbers. You just look at where the line is going, right? So what we see is social safety nets are really growing in Africa, and governments are really starting to commit to this type of program. So every country on the continent now has some sort of social safety net, and the average country in Africa has 15 different programs. So it might be school feeding together with cash and maybe various different other things. So it also, what we see is of the whole package of social safety nets, a bigger and bigger chunk is actually these cash distributions to families. So right now, cash transfers represent 41% of the overall social safety nets that folks are doing on the continent of Africa. So I just wanted to briefly bring your attention to this review that we did, and you can actually, I'm sure we'll give you these slides, so don't worry about it, but it was published in the World Bank Observer. We tried to get it in some place that the economists would think it was actually rigorous, and it is rigorous. But what we did is we looked at all of the studies that we could find that actually had any information about impacts of cash transfer programming on violent outcomes. Mostly what we're looking at is intimate partner violence. There's some that are violence against children, but mostly right now our evidence base is largely about how does it affect couple dynamics in the family. And we looked at both quantitative and qualitative data. And what we were trying to do is not only say, okay, what do we know? What does it tell us? Does it go up, down? You know, what do we know? But also, can we glean some ideas of the mechanism? So if cash, giving cash is reducing violence, why is it reducing violence? And through what pathways is it reducing violence? Because if we could understand that, we'd have a better ability to understand how we might be able to tweak the program a bit so that we could really up that and get the most benefit in terms of its reductions of family violence. And then we wanted to then use this as sort of a platform to say, okay, these are the answers, that these are the gaps that we really all need to work on collectively. So I'm just going to take you through some really simple results from that review. And so we were looking at studies up to 2017, and what you'll hear today is a couple of studies that weren't included in this review, that have come out of sort of, this is the baseline, and so now let's start to add to the evidence. So of this, we found 22 studies that actually looked at, it had intimate partner violence, IPV, as an outcome. 2/3 of those were either conditional cash transfers or conditional cash transfers plus some other kind of programming. Most were targeted at women, so most of the programs actually gave the cash directly to women. And the plus included a whole range of other activities. So some of them were participate in a nutrition training and nutrition group. Some of them were health service based. Some of them were education, or so there was a whole range. But many of them had additional programming sort of built, not related to the violence. Okay, they were there because they were trying to accomplish some other policy objective. All right, so none of these were designed or had anything to think. You know, the purpose was not to influence violence. If it did, it was a secondary sort of unexpected result. So in terms of regions, and this really reflects the evolution of cash transfers and social protection programs over time. So 2/3 of the study were from Latin America and the Caribbean, because that's where this type of strategy started back in the late 80s and 90s. And it's only been slightly more recently that you've seen the emergence of this as a strategy on the continent of Africa, for example. So most of the programs were means tested, meaning that they weren't universal, so they were trying to reach the poorest of the poor families, or women, female-headed households, or households with orphans, or any kind of thing. But so they were means tested, and most of them basically were delivering cash monthly. So these were not so much one-off. We give you cash for 3 months in a humanitarian setting, but these were things where people could actually anticipate that the money would keep coming. Over half of them were government run, and the amount really varied. So some of them were very small, so 6% of what their consumption expenditures were, up to 50%. So some of them were real, a substantial influence on what that family could access. So in terms of impacts, what we saw is 11 of the 14 studies that had quantitative results actually showed decreases. And those decreases range from about 11% reduction in IPV rates, like in recent IPV, so in the last 12 months, to 66, like 2/3 reduction in that household in recent intimate partner violence. There were 2 studies that had mixed results, so it seemed like it might increase emotional abuse but decrease physical violence. And there were really none that were across the board increasing violence. And that was a real concern, because the field has been aware that there have been examples in the past that as women have been given access to cash or employment services, that if they're in a setting where that's not yet normative, it can disrupt things and actually put them at risk. So we found that finding really important too, that it doesn't look, at least in these existing studies that have, and these programs that have been in place a while, that you're not seeing an increase. The increases that we did see, though, were stronger for physical and sexual violence than for emotional and controlling behaviors. So you seem to have the biggest impact on hitting, for example, and less on sort of the kinds of emotional or some of the other things that can happen in abusive relationships. So then the last thing we did is we looked at pathways. And so here is, we were looking at 3 different pathways, and we looked at both what came out of the studies, as well as trying to think about ways in which this cash might actually reduce violence. And we went to other parts of the literature. So we, for example, would say, if it's doing it by reducing stress, what do we know about the impact of households getting money on stress levels? And then what do we know about the impact of stress levels on rates of IPV? So even if the study didn't follow it all the way through, we were summarizing that and saying, does this look like a reasonable pathway or not? So we came up with 3. So one was sort of overall economic security and emotional well-being. The other was actually influencing conflict in the family over resources and over other issues. And then the third is sort of a woman's empowerment idea. And let's just briefly take you through this. And I know you can't see that, but the kind of general household thing, it's working. One theory is that it's working at a household level. You give money to the household, it increases food security, it decreases stress, it improves overall emotional well-being. You might actually see a decrease in alcohol use, for example, because of that, and that then the theory is violence would go down. And each step of that, there's evidence from the literature that suggests that yes, that is a reasonable pathway. And we saw that 4 of the quantitative studies and 5 supported this pathway. 5 of the qualitative. So the other one is this conflict. So here, this is like, especially, we think this may be operating in the really poor households, where what you see is women are having to negotiate every day for the money to go to the market and pay for the daily food. And that's always a source of potential conflict, right? Because the man may not have it, he may have spent it on something else, and so if you can get cash into her hands, that eliminates that point of trigger. And so we think that could go either way, depending on, you could either see it that decreased conflict over money or things would decrease IPV. If there's more money in the household, though, you could also think, well, maybe the guy's going to now use that money to go drink or gamble, and that could increase conflict. Interestingly enough, we did not see that pathway. So again, that's sort of consistent with not seeing increases. So even though people are concerned about money going to what they call temptation goods, there's no evidence in the existing literature base that really supports that as being a big problem. And so that's also an important finding. This is just, it gives you quickly, it said, there were many fights because of all the needs and that there was no money, but now that we have some money, we don't fight so much. So, you see that a lot in the qualitative. And the final one, and this is one I think that's very interesting to people that work on gender, is this idea that in giving women more money and having them participate, for example, in groups and things, and having more respect at the family level or more respect from the community, that it would shift the power in the relationship and increase the woman's ability to, in effect, get what she wants for herself and her children and have more power. That, we think, tends to operate differently depending on how the man responds to that shift. So what you see is that some men say, oh, well, great, now there's more money coming into the family, I can see the benefit, and that's a good thing. other men feel very threatened by that. And you can imagine, as with all the macroeconomic dislocations and men not being able to, be employed in the same way as they have, or work the land in the same way, that they can be quite threatened. And so then you can get a compensatory response where he's like mad that now she's bringing in money and that's my role. So it could increase or decrease. And so there's a large body of literature from other areas that suggests that this pattern exists, and it depends on the man and what's happening to him, and what's happening, and that then affects the likelihood of violence. So I'm going to skip that. So I think the takeaway messages are that we have some strong evidence that cash transfers are actually proven structural interventions right now to reduce IPV at scale. And so that's quite exciting. So we have 15, and now I've added in some of the things. So there's 15 experimental and quasi-experimental studies showing reductions. The focus, has been just on if it's happening or not. We have less information at this point about how it's affecting frequency or intensity. And we need to sort of look at cost effectiveness of these kinds of strategies versus others, or things that we can do to tweak them. In terms of what matters in terms of program design, is we think these inter-household dynamics are really key, and we need to understand them more. So, how important is it that the woman retain control? And is it better to give it to the woman, or does that actually disrupt the apple cart, so to speak, and actually it's better to give to the household even if she controls it? And then we think that the plus components, meaning the other services, probably actually have a bit to do with not only achieving whatever the goal was, health or education, but that there's extra things that are also helping to reduce the levels of violence. So as she gets more autonomy, as she gets more mobility, as she engages in these programs, we don't yet know how much of it is the cash and how much of it is this. We know that the cash alone oftentimes has an impact, but it looks like it may actually have more of an impact when it's partnered with these other programs. So anyway, I'll stop there. That's sort of where we're at, and you can hear a little bit more about some of the programs that folks are now working on to try to take the next step and figure out the more pieces of the puzzle.
Thank you so much, Lori, for this great global overview. I'm sure many of you have questions about this absolutely fascinating research, but I'll ask you to hold them for a little while until we finish all the presentations, and then we will have time for Q&As. So please make mental notes of all these interesting aspects. We will now hand over to the case studies. So I will start with a colleague from UNICEF, Dr. Tia Palermo. Tia is a senior social policy specialist at the UNICEF Office for Research, Innocenti, and oversees projects related to social protection and equity in low and middle income countries. She focuses on cash transfers and impact evaluations of interventions to combat poverty and exclusions of children, and has led or contributed to evaluation in countries such as Ghana, Ethiopia, Tanzania, Zambia, and Zimbabwe. As part of the transfer project, her work examines the ability of social policy to improve outcomes among children and adolescents, including those related to schooling, sexual behavior, mental health, and violence. Tia, we look forward to your presentation.
Thank you. Trying to find it. I'm sorry, I put up the wrong one. Sorry about that. There we go. Perfect.
Thank you everyone for joining us today, and thank you to our co-host for having us here. It's really great to be here.
Yeah, of course.
Okay, so as Lori gave a great overview, there's very promising evidence that cash transfers can reduce intimate partner violence. There are some regional gaps in this evidence, so most of the evidence that we have comes from Latin America. And the evidence that we do have from Africa tends to come from NGO programming, which is run at a much smaller scale than some of the government programs of some of our colleagues who are in the room here today. The literature has also not sufficiently covered some of these integrated social protection programs, or what sometimes are referred to as cash plus programs. And another limitation of the studies that were reviewed is that while authors often hypothesize some of the pathways and the mechanisms through which these cash transfers are having impacts, very few studies have been able to quantitatively test those pathways. And so in the current study, we worked with a government program in Ghana, the LEAP 1000 program, and we were trying to understand whether or not a government social protection program, which was targeted to extremely poor rural households that had either a pregnant or a recently pregnant woman, could influence past year prevalence of IPV. We also wanted to test what pathways was this working through, and finally whether there were any differences based on family structure. So we were looking at differences between monogamous and polygamous households. The LEAP 1000 program is part of the flagship social protection program in Ghana. It stands for Livelihood Empowerment Against Poverty. And the program objectives are to alleviate short-term poverty and encourage long-term investment in human capital. Now, the LEAP 1000 was an add-on to this LEAP program, which was specifically trying to improve nutrition and reduce stunting. And that's why they were targeting pregnant women or women with a child under the age of 12 months to really target those first 1,000 days which determine a lot of stunting. And so that's why it's called the LEAP 1000. This aspect of the program has now been rolled in nationwide. It's part of the general LEAP program. And the program gives a bi-monthly cash transfer of approximately the equivalent of 14 euros. And it also provides a plus component, which is free enrollment into the National Health Insurance Scheme. So households which are participating in LEAP are exempt from paying the are exempt from paying the premium to enroll in the NHIS. So this is an integrated social protection program because it provides both cash and the fee waiver for National Health Insurance Scheme. The initial coverage of this LEAP 1000 component targeting pregnant and recently pregnant women was about 6,220 households in 10 districts in northern Ghana. So our team worked with government and our UNICEF Ghana country office to take advantage of this expansion and do a quasi-experimental longitudinal mixed method impact evaluation. It was 2 years between 2015 and 2017. We looked at all of the households which were targeted for the program, and it also used a proxy means test, which Lori referred to. And so there was a score of eligibility based on poverty and other characteristics of the households, which determined whether or not households were eligible for this program. So the quasi-experimental design takes advantage of that score because there was a threshold for eligibility. And so we were able to compare households just below that threshold, which gained eligibility into the program, to those households just above the threshold, which are very similar in all aspects to the households that were eligible, but just missed the eligibility criteria. We have a sample of analysis that I'm presenting on today from over 2,000 women, and they were interviewed by female enumerators in private settings. And for all of the statistical analyses, I'm not going to go into the details, but we used a difference in difference methodology, and the quasi-experimental component is based on this eligibility cutoff. And you can see the map of Ghana here. We are in 5 districts for the impact evaluation. The pilot was rolled out in 10. We did the impact evaluation in 5 of those in northern Ghana, so the northern region and the upper east region. We measured intimate partner violence using a modified conflict tactics scale, and we asked women whether or not they'd experienced intimate partner violence in the past 12 months. Then we also asked about the frequency. So we asked whether or not in the past 12 months they had experienced it, never, sometimes, or often. And for each of the different types of intimate partner violence that are listed here, controlling behaviors, emotional IPV, physical IPV, and sexual IPV, there were different items that were asked. And so for all of the items, we have never, sometimes, often, and we add all those together to get a scale, and then we standardize that scale based on the mean and the standard deviation of the comparison group. So we have a continuous score for frequency of violence. Now, just to put this into perspective, if we look at the rates of IPV from the DHS, which was administered in 2009, we see that the women in our sample are experiencing approximately double the rates of IPV of the national average. So this is a very high-risk group for IPV. About 66% reported experiencing some form of IPV compared to 35% of the national population. So this is an important group to target because they are at such increased risk. And you can see that of the other types of violence, they're at similarly high rates or high risk. Now, these boxes here, this is basically showing you that cutoff that I talked about. So on the x-axis, we have this proxy means test, which is the eligibility score. And so that red bar is the threshold. If you're below the red bar, you qualify for the program. If you're above the red bar, you don't qualify for the program. And what you can take away from these boxes is that the rates of IPV were very similar among both the comparison group and the treatment group before the program was rolled out. When we examine the impacts on IPV, we saw that in the full sample, there was no reductions in reports of prevalence of IPV in the past 12 months. So that means that women were not more likely to say that they had not experienced IPV. But when we looked at the monogamous sample, in fact, women were more likely to say they were not experiencing IPV in the past 12 months. So there are differences based on household composition. And women in monogamous households were 5 to 8 percentage points more likely to report that they were not experiencing IPV in the past 12 months. However, there were no impacts on the polygamous women, and the women in polygamous households were actually at increased risk of IPV. When we looked at the frequency of IPV, in fact, in the overall sample, we did see reductions in frequency. So women were reporting IPV less often as a direct result of this LEAP 1000 cash transfer program. We then tried to dig into what are some of the pathways. So we're seeing these impacts, so reductions in the monogamous households and reductions in frequency in the combined sample. So we wanted to dig into why these reductions might be occurring. And looking at those pathways, we saw positive impacts on economic security. Households were less likely to be poor. They were spending more on overall consumption, also on food consumption. Women were reporting higher locus of control. They were reporting more likely to be saving, and they were reporting higher levels of social support. Households were enrolling at higher rates in the National Health Insurance Scheme, and they were seeking care when ill more often. When we looked at some of the other pathways, we did not find evidence supporting those pathways. So there was no impact on self-perceived stress. There was no impact on life satisfaction. And importantly, we saw no increases in partner drinking or expenditures on alcohol. And this is consistent with the global evidence on cash transfers that they do not lead to increases in these temptation goods. Now, some of the other women's decision-making and agency indicators we also did not find any support for. So just to summarize, we found evidence for pathways 1 and 3 that Lori mentioned in her presentation. So women's empowerment and economic security. So to conclude, LEAP 1000 in Ghana reduced the frequency of emotional, physical, and combined IPV. And it reduced the experience of any IPV only in the monogamous sample, not in the polygamous sample, even though women in polygamous households are at higher risk of IPV. Pathways we found support for include economic standing, emotional well-being, and women's empowerment. And these results really underscore that cash transfers can have broad-ranging impacts on dimensions of well-being beyond their main objectives around consumption smoothing, poverty reduction, and investments in human capital. Our findings suggest that family structure and household composition matter, And unfortunately, we're not able to tease apart or disentangle the impact of the health insurance waiver and the cash. These are the impacts of that combined program. Thank you very much.
Thank you very much, Sia, for this fascinating research. I think it really underscores the way that cash transfer can reduce different forms of IPV, but also the need for further research, right? To also look at the complexities of these pathways and how factors such as family structures and perhaps other intersectional factors can also influence the results in this area. Without further ado, I will then hand over to Shalini here on my right. For the next case study. Shalini Roy is a research fellow in the Poverty, Health and Nutrition Division at International Food Policy Research Institute. Dr. Roy is an economist and leader of the Social Protection, Delivery and Outcomes Research Cluster under the Consultative Group on International Agricultural Research. She brings substantial expertise conducting impact evaluations focused on gender and social protection in South Asia, Sub-Saharan Africa, and Latin America, and has specifically evaluated the effects of transfer programs on intra-household dynamics in countries such as Brazil, Uganda, Mali, and as we will hear now, in Bangladesh. The floor is yours.
Thank you, Teresia. Thank you to all our co-hosts, and thank you all for being here. So the Bangladesh case study is joint work with Mohsen Drobo, John Hadanat, and Akhtar Ahmed, and it's funded by IFPRI, the World Bank, and the CGIAR. In terms of motivation for this case study, many of you probably know this figure that 1 in 3 women globally experience physical or sexual IPV in their lifetimes. Among that prevalence, South Asia is among the highest in the world at 41%. Lori overviewed this mixed methods review that showed cash transfer programs reduce IPV in low and middle income countries. Just to highlight that within the quantitative findings there, much of that evidence comes from Latin America. Much of it involves programs that have conditionalities or trainings. And within that evidence, all of these studies look at IPV impacts during the program with very little, as far as I'm aware, none of them have quantitative evidence after the program is ended. So the focus of this case study is really to address one kind of big picture question, which is, can cash transfer programs be, 1, globally relevant, 2, a scalable platform, and 3, for sustainably reducing IPV? And underlying that big question are 3 particular knowledge gaps. So first, as I mentioned, we really don't know what happens to IPV after the programs end. Most of the cash transfer programs of the type that Lori described with these regular payments don't continue indefinitely. Households will often get them for, say, 2 years. And if everything just kind of goes back to the way it was as soon as the program ends, then this is not a sustainable solution for reducing IPV. And so we really need to know what happens after, and to date there had not been any quantitative evidence there. A second touches on the issue of scale. So as Lori described, many of the programs in the evidence have some sort of complementary programming or some sort of conditionality. Many of these can be quite challenging to implement. And as she described, many of them are kind of bundled together with the cash, and as Tia also described, it's hard to figure out which parts of the impacts come from the cash versus these other program features. And from the perspective of thinking about scale, we really want to know, are they needed for IPV impacts? Do they affect the mechanisms? And then finally, we want a better sense of how much these findings generalize globally. So much of the evidence coming from Latin America may raise a question of whether this can then generalize to a setting like South Asia, where, for example, patriarchal norms and female seclusion still prevail. So, for example, female seclusion referring to the idea that there are norms around women staying within the home or traveling outside the home only with male accompaniment. You might imagine the dynamics around transfers to women might be quite different if they aren't able to go to markets by themselves. So this case study really contributes to 3 specific points. First, we investigate what happens after the transfers end. 2, we disentangle the effects of transfers from the effects of other accompanying features. And 3, we study a context in South Asia, Bangladesh, where IPV is high and norms are conservative. So the specific study setting is a program called the Transfer Modality Research Initiative, TMRI. And this was a pilot safety net program in Bangladesh that was designed as a cluster randomized control trial, implemented by the World Food Program and evaluated by the International Food Policy Research Institute, or IFPRI. This program provided cash or food transfers. In this presentation, we won't focus on the distinction there. What we will focus on is that some of the transfers were provided with an intensive nutrition behavior change communication, and I'll tell you more about what that means, and some were provided without, and that was randomized. And the program was implemented from 2012 to 2014, so for 2 years. It was targeted to mothers of young children in poor rural households, and this program had no explicit gender objective. So although I'll tell you a little bit about how the design could be considered gender sensitive, the aim was really to improve household food security and child nutrition. And in fact, IFPRI's evaluation was initially focused on those outcomes and not focused on gender. The BCC was, the Nutrition Behavior Change Communication, had 3 components. The core of it was these weekly group meetings that you see a picture of here, of 9 to 15 women in a village with a trained community nutrition worker. What I mentioned about the gender-sensitive design, some of these sessions also invited other household members to join, including husbands and mothers-in-law. And so these sessions were focused on infant and young child feeding. So part of the motivation for inviting other household members was to kind of, bring the messaging to other household members who are influential to increase take-up. But it also had the dimension of trying to increase acceptability of women coming to these sessions. So once the mothers-in-law and husbands came and saw what these were all about, they were much more okay with women kind of leaving the home to go to these every week. These sessions, despite kind of being about a pretty technical topic, were really interactive and fun. And women actually quite enjoyed them. For them who tended to be quite isolated, this was actually a really kind of transformative social opportunity. They had kind of a group of friends, they came early, they stayed late, and they genuinely enjoyed these sessions. The second component was twice a month home visits by these same community nutrition workers. And the third component was monthly meetings between the program staff and community leaders. Again, this partly was to kind of get the messages out to the community at large, but it also was to kind of sensitize the community to the importance of women coming to these meetings, so to kind of overcome some of the gender norms around women's mobility. So, as I mentioned, the main study had not been about gender, but what we did to look at post-program impacts on IPV was that we did what we referred to as a post-endline survey, 6 to 10 months after the program had ended. So in the green there, you see the 2-year program period. 6 to 10 months later, we went back and administered the WHO Violence Against Women instrument to the former beneficiary mothers. In order to conduct the analysis that we did for the IPV study, we also drew on the longitudinal data that we did have from the evaluation period. And we also drew some insights from a qualitative process evaluation that had been done during the intervention that was not specifically on gender or IPV, but which shed some light on some of the mechanisms that we believe underlie our impacts. So the study design for the IPV study compared 3 modalities. So we had a control group, which was the arms that had received no intervention, the transfers group, which lumped together the groups that had gotten cash only or food only, and then the transfers plus BCC group. So that lumped together the groups that had gotten cash plus BCC or food plus BCC. And I can tell you quickly that there were no differences within these lumped together groups. We saw no differences, but I'm not going to get into that in this presentation. So for a sample of 2,231 women, we exploited the fact that these were randomly assigned groups to estimate first the post-program impact of transfers alone on IPV, second, transfers plus BCC on IPV, and third, to try to look at the mechanisms for the impacts we find. So here's our core result. This figure shows at post-endline the prevalence of physical violence that was reported in the past 6 months among the control group, the transfer-only group, and the transfer plus BCC group. And what you see is in both the control group and the transfer-only group, the prevalence of physical violence is 27%. In the transfer plus BCC group, it's 20%, a 7 percentage point reduction, and that's a significant difference. And that represents a 26% reduction in physical violence from transfers plus BCC, and this again is 6 to 10 months after the program ended. So what this means is that transfers plus BCC significantly reduced physical violence well after the program ended. Meanwhile, transfers only had no significant impact 6 to 10 months later. So how do we think it is that the transfers plus BCC led to these sustained reductions? I'll try to go through this extremely quickly for how much is on the slide. But referring back to the mechanisms that Lori described, what we believe is that based on suggestive quantitative and qualitative evidence that there were 3 mechanisms at play. First, we believe that the transfers plus BCC relative to transfers only had sustained effects on improving women's bargaining power. That's in terms of her economic resources, her agency, and her social capital. So as I mentioned, these BCC sessions themselves increased women's social capital. Moreover, the fact that women now became viewed as a knowledgeable member of the community meant that neighbors were now coming over to hear from her what she had, she knew more about nutrition than they did. They came over to ask what they should do with their children. And these were such poor women that they previously been seen as, beggars and pariahs. Suddenly they were kind of seen as respected members of the community. A related dynamic is that as women became more visible and respected in the community, violence inflicted by their partner against them became more visible, so it was more detected, and there was more what's referred to in the literature as social control against it. So there was more disapproval on the part of the community and more kind of repercussions for her partner. So it's what we refer to as an increased cost of violence for the man. And then finally, I won't go into the details of this, but we actually see that the BCC increased household wealth as well beyond the transfers only arm. And so we believe that this could have resulted in the poverty-related stress and conflict pathways that Lori described coming into play as well. And we have a quote where a woman was described as saying that if she asked her husband to buy some food when there was none in the house, he would become angry and hit her. But now she says he's generally quite pleasant and doesn't fight with her anymore, which very much echoes the qualitative findings that Lori described. So to wrap up quickly, it's worth noting that in this context, where some might fear cash transfers targeted to women could lead to a backlash, we did not find any increases in IPV. But 6 to 10 months post-program, we found a 26% reduction in physical IPV among women that formerly received transfers plus BCC, while there was no impact at all on those that had received transfers only. Our suggestive evidence, which I didn't get into here, is that, in fact, both the modalities, transfers only and transfers plus BCC, had reduced IPV during the program, but that the plus BCC was required to sustain the impacts beyond the end of the program. And essentially, in the transfer-only arm, things went back to the way they were as soon as the transfers ended. As I said, we believe this comes through women's bargaining power, men's cost of violence, and poverty-related stress and conflict. This is, to our knowledge, the first quantitative evidence of transfer programs having impacts on IPV beyond the end of the program. And we think the real takeaway here is that transfer programs can cause sustained reductions in IPV, and this is even without any gender-focused objectives. But they may require some sort of complementary activities that sustainably affect the pathways for impact. And so when the transfers disappear, there needs to be something that continues. In this case, we think it was that the BCC led to women's status sustainably improving beyond the end of the program. And just to mention, as Lori said, you'll have these slides, I think. So the link for the academic paper is on the left. The picture on the right is a little brief that we have of this study, and just to plug a few other little briefs we have right outside the door. On the counter over there, you'll find a little postcard that summarizes Lori's review paper, as well as this study and a couple other studies we have on cash transfers and IPV. So please don't forget to look for them on your way out. Thank you.
Thank you so much, Halini. I think this is absolutely amazing and so exciting research, and I just hope there can be an uptake really among us who are implementing cash-based intervention at a large scale, as well as from donors, to really understand how through this complementary programming we can, generate these long-term sustained changes beyond the program. I think we have an enormous opportunity here to really leverage cash transfers in a better way. So thank you so much for this amazing work to help guide us in this area. I think we will now move into some of the hardest settings on the planet, where women and girls are the most marginalized, the furthest of the furthest left behind. So we're leaving the development settings where we have the majority of the evidence emerging, and now starting to look at the evidence in the humanitarian setting. So I will hand over to Dr. Catherine Faub, who is a social epidemiologist and senior researcher at the International Rescue Committee, a global humanitarian aid organization. Her work aims to find innovative and effective solutions to reduce violence against women and girls in settings of humanitarian crisis and conflict. Part of this work includes seeking to better understand the linkages between cash and protection to maximize cash potential positive impact for women. Dr. Faub, the floor is yours.
Thank you. Thank you, everybody, and good afternoon now at this point. So I'll be providing a complement to the previous presentations that we've just heard and really providing a bit more of an overview from a humanitarian perspective and use a case study from Syria. So overall, I think many of you can tell throughout these presentations that the use of cash has been increasing in recent years. And in fact, in 2015, just 6% of humanitarian aid was delivered through cash programs. But since then, there's been a number of global commitments by multiple organizations to increase their use of cash, as it's seen to be one of the most efficient and effective modalities to reach the highest number of people in the least amount of time who have the most urgent needs in some of these acute crises settings. And in fact, this is just a graph of IRC's commitment to cash programming, where we aim to deliver 25% of our humanitarian aid through cash by 2020, and we've already exceeded that goal a year ago. So why is there such an increased investment in cash in humanitarian settings? Well, the answer is pretty clear that it can help people meet their basic needs and improve food security in emergencies. And typically within humanitarian programmings, I think one of the key differences and contrasts from the previous programs that we've heard about is a bit more short-term in nature. And so typically they could even be one-off transfers, or more a standard approach can be just a 3-month-long transfer. So that's one of the key characteristics of cash programming in humanitarian settings. 3 other characteristics that are quite common for humanitarian settings are, one, that it's multi-purpose cash, meaning that there's no restrictions that we're placing on how people can choose to spend their cash. The third characteristic is the fact that most commonly they're unconditional cash transfers, meaning that people aren't going to have to participate in additional programming to receive cash support. And the fourth and final important characteristic within humanitarian settings is that it's just targeted towards the heads-up households based on vulnerability scores, and there's not a clear strategy as to whether the man or the woman in the home really receives the cash. And so those are the 4 key components of a cash transfer program in humanitarian settings, just in broad overview strokes, of course. And this is their theory of change. You give out cash and household basic needs are met. However, we know from all of this previous work, and really drawing from the review that Lori discussed, that there's a number of other pathways that can be occurring when cash is injected into a household. And so, based off of this, we developed this theory of change with some of our programmatic colleagues as well, and we thought, well, if household basic needs are met, we thought that maybe households could also be experiencing less sexual exploitation and abuse in humanitarian settings and other negative coping. We also thought that there were a couple of pathways that might lead to intimate partner violence changes for married women in humanitarian settings. And the first one that we've been hearing about consistently from the previous presentations that were also examined was, if household basic needs are being met, maybe there's less household stress, and then maybe there could be a reduction in intimate partner violence. And then the other pathway that we were interested in exploring was whether increased access to money for women and increased control could potentially increase or decrease intimate partner violence based on a variety of factors within the couple. So we decided to explore this theory of change, and specifically sought to examine how this can operate in a cash transfer program in an acute emergency setting. And so we scoped a number of potential sites where we can possibly implement this research study, and we ended up landing in Raqqa Governorate, Syria. And this study was conducted in villages where ISIS was recently withdrawn, and so humanitarian aid programming was just now starting to reach these villages. And so it really mirrored an acute emergency setting that we might see in other places. In addition, within the populations where we were conducting this research, a lot of the folks were internally displaced, fleeing Raqqa City or other places due to the civil conflict or the recent airstrikes that were in close proximity to the study timing in Raqqa City. So that's the overall setting where we conducted this study, and in order to explore these different pathways, we talked to 500 women before they received the first cash transfer, and then our typical IRC cash transfer programming was delivered for 3 months. And about 2 to 3 weeks after the final cash transfer was distributed, we went back and talked to women to understand how some of these might have changed. So what you'll note is that I just described a pre and post test with no comparison group. And so the big takeaway from all of this and limitations that we cannot confirm causality in any of these, especially compared to the great designs that other folks have talked about. But we went back and we looked at all of our quantitative findings, the in-depth interviews with women, and we had research validation workshops in country with our program team, and we really tried to figure out, well, what does this actually mean for our theory of change and what's happening when we're giving cash to these homes? And this is the theory of change that we landed on, essentially. We saw really great increases in ability of households to meet their basic needs. So cash programming in these villages in Raqqa Governorate were able to meet its primary objective, which was great. And we also saw significant reductions in food insecurity for these homes. We also found, by and large, significant reductions in negative coping, which is more of an economic term, but it actually comprises a bucket of strategies that households might turn to meet their basic needs. So this could include, in this case, significant reductions in begging and resorting to debt, in selling off assets, etc. We didn't actually find that this type of cash programming influenced exploitative work or turning to child labor, for example, but I think that seems pretty intuitive given the short-term nature of this program, and it wouldn't necessarily disincentivize these more exploitative strategies to help households meet their basic needs long-term. The other key thing that you note within this bucket is that there's no statements made about sexual abuse and exploitation. And unfortunately, just over the study period, we had to remove questions in our end-line survey around that due to increased scrutiny. We are still exploring that in future studies, hopefully, to understand the linkages between cash and that specific form of gender-based violence. The other key finding that you'll note is that there's no pathway anymore around reducing household stress once household basic needs are met. And this is because, in talking to the women and doing all these in-depth interviews, you would hear time and time again about how appreciative they were of the cash program and how it really helped them to get access to medicine or food or even start saving for different capital investments for their home potentially. But when we started mapping out what was happening over the transfer period, once we got to the end of the program, they were filled with such anxiety still because these were such short-term programs. And so it seems that when we're looking both quantitatively and qualitatively that they kind of canceled each other out. And so we just don't think that that's a clear pathway that's happening right now with this shorter-term program. And then the other key thing that we found was a change in intimate partner violence. And one of the positive findings, we did find increased decision-making for women in these homes, particularly for married women around joint decision-making with their partners. However, this was also correlated with an increase in intimate partner violence, and specifically looking at sexual IPV and economic abuse. And again, we can't confirm causality around these findings, but it does speak to this pathway around men potentially using violence or abuse to reassert their position and power within the home. Although, of course, there can also be other exogenous factors leading to that piece. So just from that case study and a few other studies that IRC is undertaking on cash and protection, we've identified 3 buckets, so to speak, of learning priorities that we'll be investigating over the next couple of years. And the first is around risk mitigation. And this is really to design cash programming to monitor, minimize, and prevent risks to women and girls throughout the cash transfer cycle. And in particular for the monitoring piece, we're referring to post-distribution monitoring from our cash teams to be implementing and really supporting clear referral pathways and communication between our cash and GBV actors in the field. And we're actually piloting a toolkit around broader protection concerns in Afghanistan called Safer Cash right now. But if you're interested in more of a GBV-focused toolkit, I would refer to the Women's Refugee Commission because they have a great piece of work out on that. And then in terms of minimizing risk, just thinking about better communication with beneficiary and the target communities around this jealousy component, and developing clear exit strategies for cash programming. The other learning bucket that we're going to be taking forward is testing different design and delivery elements to maximize potential positive impacts for women. And really exciting, we actually have a follow-on study that will be returning back to Syria in a couple of weeks short time to launch a new study to develop and test plus components using a user-centered design approach with women to really hear from them how we can potentially tweak cash transfer programming in terms of labeling or other behavioral approaches, et cetera, to really help them make decisions with their husbands or their other male family members, et cetera, to empower them within the home. The other key component that's more operationally focused that we're going to be exploring is around testing different tweaks to cash programming around manipulating the gender of the recipient of cash programming, thinking about the size of the transfer, duration, et cetera, and how that might influence outcomes for women. The third and final bucket is around the scale and sustainability of cash programming and testing how to take programming at the early stages of an acute crises to scale. So thinking everything that we have to do has to be very quick while assessing for contextual realities and feasibility of cash programming in these settings. And then how best to transition from short-term emergency cash to longer-term livelihoods opportunities for women. And really thinking about how we can better fill this humanitarian development early recovery continuum gap. And I hope with that there was a number of interesting pieces that we can explore further in the Q&A session. Thank you.
Thank you so much. We very much echo the need for doing more research, particularly in humanitarian settings, as we are really seeing an extremely rapid growth in the use of cash-based interventions. So this research is very, very much welcome. I think with that, I will open up for a round of questions and answers. We'll take a couple of questions, and then perhaps we can go around for all the speakers. But yes, please. Thoughts, comments? Yes.
Okay, my name is Mark de Wiethals from Belgium. I also had a cash transfer pilot project in Uganda. We just recently finished with that, in which we chose to give both men and women in the household a cell phone, and through mobile money we gave them the same amount. And for the children we also provided, so there was also a children component in, which we gave to the female caretaker. Now I was interested if there were already also large-scale tests where both men and women got that kind of intervention.
Wonderful. Thank you. Other questions? Yes, please.
Okay, thank you. My name is Mauto from Ghana. Just want to find out from the presenters whether in the research that they did, they have had any interaction with the men, or the husbands of the beneficiaries, and what are they finding as far as the behavior patterns or the household dynamics in terms of the relationship between the husbands and the wives that probably might have contributed to the reduction in the IPV.
Wonderful. Thank you very much for bringing some gender parity to the discussion. Any other women or men from the audience? Yes, please.
Thanks, and thanks to the presenters. Maybe mine is more of a contribution following an assessment that was done by UNDP for, actually I'm from Tanzania, and so the productive social safety net that Sarah highlighted earlier, there was an assessment that was done, and on the aspect of intra-household we learned that it's a process because PSSN gives cash to women, but in the beginning, the intra-household violence was quite going up because of that resistance from men not being ready for that. But then at some point it started going down. I think after they reported that after kind of discussing and seeing the trade-off of whether we start fighting or we settle down and agree to this and continue benefiting. So you either lose the benefit or continue receiving if you settle down. But we also learned that there are some cases where men had negotiated with their wives that, okay, once you get the cash, then just give me a certain amount that is for my use, and then the rest of the cash is like for the rest of the household use. So it kind of like went that way, and this was published in 2018. So hopefully maybe in the future, if another assessment is done, to kind of like learn how far or how is it going now. But I wanted to just highlight that this is like, it's not like a straight line that it be accepted straight forward. And the cultural norms aspect come into it, and that's where you see the negotiations is going up and down. Just wanted to share that.
Wonderful, thank you very much. Any last question, and then we'll do a round of answers for the Noah? Perhaps on the questions on engagement with men and boys, maybe Shalini, I know you've done interesting research in this area. Would you like to take a first stab at that?
Sure. So that's a great question. I think as the focus in these studies has been on women, your point is a very good one, that implicitly the perpetrator here is the man. And so that is, and when we speak about stress in the household affecting violence, we're kind of thinking of men's stress triggering his violence, right? So it's useful to think more about the man. In the Bangladesh study, as I said, we did not originally focus on violence when we were conducting the main evaluation, and our follow-up also focused only on women. So there we don't have direct interviews with men. Women did say their relationships improved with their husbands. In another study I've worked on in Mali, we did actually interview men. And that was actually a program that was targeting cash transfers to men. And there we did find reductions in men's stress being the primary mechanism for the reductions we found in IPV. I think we found reductions in stress and measures of anxiety. And they basically said that their role kind of culturally was to be the one who provided the household with enough food. And now that they didn't feel kind of vulnerable about that, their emotional well-being was improved, and that had reduced kind of their tendency to trigger violence.
So even in a cash transfer program that didn't target women but exclusively targeted men, you saw these effects of a reduction in IPV. I think that's also very, very interesting. Anyone else would like to add on to that question?
Well, just let me stand up so I can see people. I think in response to that, as well as your observations, I mean, I think where we're at a very interesting period of time, because all of the research that you've heard now is on programs that were totally agnostic to the issue of violence. They, and we've been trying to in a U.S. term, piggyback on the back to try to figure out what we could but not having any control of the design of the studies and things. So we hope we're to a point now where we can generate enough interest in this to really go in and start to look over time, for example, because we see this, separate in other programs, in other kind of women's employment and micro enterprise and things. One of the things that we see is, what happens in the short term may, for some subset of women, increase risk as the whole kind of dynamic gets upset. But then over time, as more and more women, and it becomes normative in a setting for women to be employed or to exit the home or anything, then you see decreases. We also have learned things in other programs about how to mitigate and help make, to help women and men manage that period of time where things are changing, so that hopefully you don't end up with these kinds of increases. So for example, there's nothing going on in these programs to bring up and talk about the fact that things are changing now. And what does that mean? And what does it mean? And how can we move from all of the pressure being on the man to provide and the idea that women shouldn't be, to being saying the world has changed, families need, none of us can do it alone. We need to work as a household to bring this forward. Can we find a way to introduce new ways to talk about funding and cash in these settings? And I think there's lessons from other kinds of interventions that could productively be brought into the social protection world. But this is like just the beginning of these two worlds talking to each other. So I think that there's a lot of potential, and what we're trying to do now is really get a program where we can try out different things with programs and countries that are interested, and actually from the beginning design to look at what's happening in the family and what's happening with dynamics and things, so we get a better sense of it, I think.
Have you found programs where you would be doing that?
Well, I think that right now, what we're doing is as I said, working on programs. Some other economist or something has a big evaluation going with a government, and so then we come along and say, can we please look at this little question, right? And sometimes they say yes and no, but we're not part of the big negotiations up front. And what we want to get to is to find, governments or programs or projects that are interested in saying, okay, let's sit down together and figure out if we were going to answer some of these questions, how would we do it?
Thank you. Any additional thoughts from your side?
No, just support everything she just said.
As usual. Of course. Sarah, anything on the reflection on Tanzania? No, nothing goes with the presentation.
Yeah, so just a quick response. We're actually going back in Ghana to interview both men and women qualitatively on some of these aspects, following up on the study, which I think you saw some of the original findings at the LEAP 1000 workshop. Did you have a...
Just to add, you see, as my colleague said earlier, the cash transfer programs were not designed to address the issue of IPV, but rather to address the economic challenges and the households were facing. As we started implementing the program, we realized in households where the men, especially in the northern parts, where the men, are the decision makers, etc., when the women started receiving the cash, some felt their position is threatened. No, bring the money. And, this kind of situation was emerging. So quickly, what we have to do to move in, now to meet with the men to educate them, look, the basic reason we are giving this money is ABCD, to address the household income, to support the family, to enable the children to access to school, etc., etc. And knowing that the women are the ones who take care of the children, who keep the home, we felt this is the best way to do that. So from that point onwards, we started engaging the men more. When we are adding more people, we engage the men more to really understand why we are in the household and how they have to complement and support the women to do that. And again, as we introduce the livelihood creation of programs, opportunities as a cash plus, what role do the men play so that that understanding will know it is not a kind of power relationship where we are take power away from the women and the men and give to the women, rather to complement each other. So our lesson is that in the design of such programs, we should not leave the men out. We should involve them from the word group for them to understand. And they also know that it's the women are the one who keep the home. And therefore, if the transfer of the cash is going to the women, it is rather to support them and to enable them to, have more time to do other things to support their family. So this is how we have addressed it, and I believe maybe if you come back and you begin to engage the women or the men, you will find out some of this supportive role that the men are playing to support the women in addressing these relationships in the household. Yeah, thank you.
Yeah, and just to add quickly, I mean, everyone here in the room knows that violence has multiple causes. So it's not just the economic stressors. I mean, the economic stressors are really what we're focusing on today because we're talking about cash. But we also know that there are social norms around violence, and those contribute a lot to perpetration of violence in the first place. So I think it's a very delicate balance, because what's so attractive about cash transfer programs is that they're lean, they're efficient, and they're scalable. But we also know that cash alone can't do everything. And so that's why there's a big push for integrated programming in Cash Plus. And our government colleague from Tanzania here, I mean, the Tanzanian government is really doing a lot in terms of Cash Plus programming. And one of the things they're really doing, which is exciting, is targeting adolescents. And the Cash Plus program from Tanzania adolescence is an important period, because we know that social norms start to intensify, gender socialization intensifies during that period. So it's a key period to intervene. And so we know that cash, it does really positive things and has broad-ranging impacts beyond these poverty objectives. But at the same time, it's a delicate balance between what do we add to the cash transfer program and how scalable it can be.
Thank you very much. I think I also wanted to add, you mentioned the mobile cash program in Uganda. Also in our literature review, we are also looking particularly at the issue of technology and the anecdotal evidence that is emerging on that, both on the use of mobile phones, etc., and the impact that has on protection and violence. But also, UN Women is now, we are also looking into even other emerging technologies, such as blockchain technologies, etc., and also what that will mean, as that also is entering the space of cash transfer programming in humanitarian spaces. I think with that, time has flown very, very quickly. I will hand over to our co-host of today's event from Sida, Eva Johansson, Lead Policy Advisor for Gender Equality at Sida, for some closing remarks and reflections on today's session. Yeah. Eva, floor is yours.
Thank you. Very, very interesting, but I must say, very sorry to be late for the introduction. But I think I got most of the presentations, which I think is most important. So I'm Sida's Lead Policy Advisor for Gender Equality. I'm based in Stockholm, and I'm attending the CSW here, the Swedish delegation. And I've had a lot of discussion with my colleague at Sida in Stockholm, Ulrika Lant, whom I'm sure you know, before coming here. And we were very happy to co-host this event with you, and I'm really happy to see a full room here also at UN Women. It's a very important area of work for us at Sida, and we are also strengthening our support. Also, we see a lot of potential in social protection, obviously. We've had also a lot of discussions regarding humanitarian assistance, for example, also in cash transfers. So it's extremely timely, I would say, to have this discussion on research and findings, and I think you really captured here to get the many angles into it, and you dig rather deep also, which is important. And I think this distinguishes possibly also this side event to many of the other side events, the CSW, and I think that's a very strong and important sort of angle to it. I'd like to just make I don't really have many minutes, but I'll just say that I think many of the questions that you have raised here and also presented are really something that we need to find more about, learn more about. I just picked up a few, that's on the sustainability, of course. And how it changes over time. I think this would be very important to look at. And also on the scale and the complexity of the issue. And I think in terms of what you highlighted also in terms of looking more deep into the frequency, for example, and the number of incidents, just to sort of getting a better understanding, because so we are not saying that correlation is a simplified correlation, but that there are complexities, and I think that will only strengthen how we can, understand and make the justification and adjustments and all of that. So I think that's something important, and also what you mentioned about looking at where can we, both target but also research more, and you mentioned also adolescents and young mothers, for example, as some of those areas. I was very happy of the remarks about the men and boys engagement. I think that's an incredibly important dimension. We need to always, when we talk about gender equality, have really the gender equality dimension in our work. So, whereas we are talking about usually men's violence against women, it's still a very, very important dimension. And how can cash transfers also ultimately lead to a transformation of those relations? And that's a huge achievement if that's the case. Now we are looking at intimate partner violence, but we can also have a sort of broader outlook. And I think as Sida we see that opportunity and that possibility also in that. And so also the setting also, whether it is a humanitarian setting or if it is a sort of development setting, probably plays an impact as well, certainly on the duration and how long, but also possibly on the, if you're adding the conflict dimension, it's very important. So I'm not going to summarize because I don't have, I think, the capacity either, but certainly not the time. But I would like to mention that we at Sida also have, actually we printed it only last week, and I think I even got a few copies. I'm not going to, make a selling point out of this. I'm just going to share with you where our thoughts are, and that's on the gender and social protection. And we are trying then, because I'm working in the policy division at Sida on gender, and trying to see, so how can we become better at analyzing also at the as a donor, and understanding both the complexities, but also how it learning from the good examples, and how can we also support the research that you are doing, which I'm very happy to say that we do, and help also our program officers and country officers in entering into dialogue and in having the eyes of, when you're looking at the cash transfer program. So what are the impacts of, to really go in a little bit deeper in our understanding. So we have done a brief. I'm going to put a few copies here, so you're more than welcome to take them. They are meant for Sida staff, but it's written in English, and I hope that's useful. So I think I wanted to also just I think touch upon I think that's a little bit what I wanted to say, but I think that the main message for me is that we are very grateful for the work that you are doing here, both you and women. We have Innocenti and we have IRC and other partners and countries. I think you are really pushing the agenda forward, and you are creating opportunities for us also as donors to learn and to make the right decisions. I think that's very important. I think that's basically my main sort of takeaway from this. And we are looking forward to learning more. So I hope you continue with the research and engage with my colleagues and other partners as well, and spread a little bit the word, because it is very interesting. On the other hand, cash transfers is one particular angle where many donors are acting differently also, and many partners are acting differently. I think for us at Sida, we are very appealed by the plus dimension of of cash transfers, when you actually make the linkages to other interventions and programs. And I think there we also have the opportunity to be having a more sustainable impact also. So I think I would like to close with that. And since I didn't open the meeting, I will take the opportunity to close it by saying thank you very much, and thank you for inviting us also, and thank you for coming and being an engaged audience to this meeting.
Thank you. Any last words from you, Sarah?
Okay, thank you. Thank you very much for that. Maybe I should congratulate all of you for those who have presented. Really, it was a nice presentation, very informative. But one thing for sure, I see that we have a work to do, because still we have some mixed results on all this. Yeah, and so for those ones who have a positive impact, I mean, we should try to scale them up. But again, we should try to find more evidence for those who have not given the results which we want. And I think for me, country context is very important when we're doing that. But one thing for sure, I think it's very beneficial for African countries like us who implement this kind of program. I think cash is necessary, but again, is not sufficient for what we want to achieve. So, like the IPV thing. So, for me, I think this evidence is very useful to the African countries to bring a debate on how we can strengthen the understanding of cash transfer, and also try to reduce this myth of, cash being an handover, cash like you hand something like that. So I think this is very good for us, and if I be specific for my country, I think this is also good to inform the policy which we have, again, already mainstreaming the cash thing. But maybe if I can also add what I see, also linkages, cash transfer is very important. The multi-sector approaches, the cash plus, like you said, the adolescents in nutrition and all that is very important. And also coordination into all these things, because the moment you try to link all these things, if you don't have a multi-sector coordination of this, again, you won't achieve what you want to achieve. So really, I think the way forward may be what we need, try to gather all this kind of information, try to present into the policymakers, and see how we can seek for more evidence into this. So thank you very much.
Thank you very much. With that, I will then take the opportunity to close this. I think it's been an extremely rich side event. I agree with you, Eva. A little bit unlike many side events that we really were able to get to quite a level of depth on the issues. As UN Women, we will certainly continue to be engaged in this space, and I think we're following, particularly with very great interest, the research around cash plus programming, as we see that the emerging evidence that this can hold a particular potential for sustainable, gender transformative change. So I really hope that, as this evidence base is now mounting, that this is something also that, we together with donors are able to then also make sure makes a difference in the life of women and girls around the globe, and men and boys, of course, as well. So thank you all very much. I would with this like to invite you to have lunch with us and hang around and ask more questions and speak more with this highly qualified panel. Thank you.